We'll look at another aspect and another thing that could result into hypertension in patients. That's like another thing that could cause hypertension in patients. And this is when patients are taking too much salt and also lack of exercise. So there are actually two causes. So I just want to discuss them together. Do you understand? They are not related, but yeah, they are related, so to say, as all of them they could cause hypertension. Do you understand? So if somebody is taking too much salt and the person is not doing good exercise, this could result into hypertension. And let's look at that. So this is high salt intake. So you can see the various things that high salt intake will cause you. Okay. So let's look at it in depth. So just so you know, the two of them, they are lifestyle factors. So to say, there are things that you are doing with your life that are affecting you. Okay. So excess salt intake, sodium and water retention. So if you take a lot of sodium, of course, salt is predominantly sodium, sodium chloride, predominantly sodium. It causes the kidney to retain more sodium again. Okay. And as sodium is being retained, it pulls water with it. This will now increase the blood volume. This will increase the blood pressure, leading to hypertension. There's also increased cardiac output. So more blood volume means the heart has more work to do. And the heart is becoming weak and weak. Okay? Vascular change. So over time, the blood vessels are becoming stiff. They are no longer flexible. And blood is no longer being pumped, very well and all of that. So hormonal effects. High salt can alter the renin, angiotensin, aldosterone system and also the sympathetic nervous system. Okay, so result now, as the blood pressure is continuously being high, you know, especially in salt sensitive individuals. Okay, it is basically, the cycle is continuing and the damage is actually becoming more and more. Okay, so sedentary lifestyle, so to say, you are not doing good exercise. So there's lack of exercise. And so there's reduced vascular flexibility. So physical activity helps your blood vessels to be flexible. Okay, helps your blood vessels to be flexible. So the more you're always just being in one place, it makes your blood vessels to be stiff. So weight gain and obesity. As you are staying in one place, your weight is just increasing, and complications are surely to set up. So insulin resistance, so lack of activity will worsen your metabolic health. So your body will be resisting insulin. Also sympathetic overactivity. So inactive individuals often have higher resting sympathetic nervous system activity. This will raise the heart rate and also the blood pressure. So this is what we have for excess salt intake and also lack of activity and how it can contribute to causing hypertension.